Thank you so much for your time and good morning to you. Quite an important question, I think, for all of us to consider. What lessons should be taken from this global pandemic?
Good morning. I think many lessons for all of us worldwide, it's not just in South Africa, from the global pandemic. We've done some things really well and some things less well. Where we are now is sort of at a dramatic pause, isn't it? It's we've seen a variant which has caused less severe disease, and we're hoping that that is going to continue, but we want to balance that with responsibility in a country where we still have less than 50% of our population vaccinated.
Yeah. In terms of government, perhaps let's just divide it for a moment. What are some of the lessons for government, particularly their response rate? Were you satisfied with the sense of urgency with which they responded to the pandemic?
Well, I think South Africa was praised by the WHO for their initial response, their quick response. We all knew that we had a lot of preparation to do. We have a very large population. We have a very large population who depend on the state, and preparation for that was important. We saw the lockdowns regarding alcohol and things like that, which were very controversial, but certainly helped us as clinicians. So there was a good response.
Yeah, but with that response, why do you think the world responded the way they did to South Africa and the rest of the continent? I mean, we've been praised, like you mentioned, by the World Health Organization of having one of the best scientists in the world who were able to detect even those variants. However, we still experience those travel bans, Veronica. We still experience, not everyone has access to vaccines. Why do you think this is so?
No, absolutely. I think the travel bans, look, I mean, for all of us worldwide, this is not something, we're sort of building the ship in the storm, right? We don't have too much to go by historically. So the travel ban was an overreaction. I think we have excellent scientists and we have transparency among our scientists, which is to be praised, as it has been. The travel bans, especially in the last wave, was certainly a bit of an overkill. So we have seen that perhaps that's not South Africa's error, perhaps that's the rest of the world's error in the way they responded to what we have done. The availability of vaccines and the vaccine hesitancy is a topic completely on its own. We were a little bit late in the starting blocks to procure vaccines. But our major issue now is actually still vaccine hesitancy, which we need to address at various fronts.
When we talk about hesitancy, what informs it? Is it the lack of adequate information in the media, out of adequate access to communication to the public? Why do you think there's still a group of those who still do not want to get vaccinated?
I think there are various reasons in South Africa. I think we should probably have decentralized a bit and focused on community level, in terms of engaging our local leaders, our religious leaders. I think there are a lot of misconceptions still about vaccination in South Africa, which is really tripping us up. I think some misinformation. And perhaps if we were to have more local representation among people, that the community trusts, that would be a lot easier. I don't think all of the misinformation, mismedia, certain campaigns are helping us. And I think people have there's a lot of information there, which is potentially difficult to interpret if you don't have a background in how vaccines are made and the process of vaccination.
Right, but it seems even those who are vaccinated, those who do, go with the regulations and try to understand the health protocols, are COVID fatigued. They say we want our lives back, we want a sense of normalcy back, right? So what do you make of COVID fatigue? I mean, we also still hear the president saying, still wear your masks, even though we're on lockdown level 1, still abide by the regulations. So how would you then sort of compare South Africa to the rest of the world in terms of COVID fatigue?
Well, there is a lot of COVID fatigue. That's even among healthcare workers. It's been a tough 2 years. Everybody's ready to move on with their lives. And we're comparing ourselves to countries with higher vaccination rates, which seem to be moving on with their lives. We've seen, even with the last wave, we see such a different experience in different parts of the world. But COVID fatigue certainly is an issue in South Africa, and we need to acknowledge that. And I think we've seen some lifting of restrictions. We've seen some degree of heading towards normality. However, we must remember that we're still reporting daily mortalities. So pre-COVID, if we had a disease where every day we saw mortalities, that would cause panic, wouldn't it? So this is still dangerous for the vulnerable and for the unvaccinated. So we should balance that release of restrictions with still being responsible and protecting the most vulnerable in our society. And dealing with COVID fatigue, I think if we just if we rationalize and we understand, we're talking about, for instance, masks, where mask wearing would probably continue indoors, certainly for quite some time, but maybe they could be relaxed outdoors. So a gradual process rather than this massive, change in policy that would probably see us a few more deaths than we'd need to.
Right. I think everyone's probably thinking, will we have another global pandemic similar to COVID-19? Should it happen? And I'm not calling into existence. We're just having a conversation about what can we do to implement those lessons that we've learned so that the impact is not as harsh as we've seen in COVID-19. How do you think we could be better prepared for any future pandemic?
Well, I think there's a few things that COVID has changed positively, and certainly pandemic preparedness is a huge component of that. And we've seen that worldwide, a lot of money is going into science around pandemic preparedness. We will probably see more pandemics, right? We're a global community. There's a lot of travel. There's a lot of interaction that the previous pandemics didn't see. And I think the focus worldwide, and many of our large institutions and the WHO are calling for scientists to first of all do research for better surveillance and for better readiness in terms of pandemics in future. And I think we've also learned from this pandemic what works and what doesn't. So hopefully we would do better in future, but we probably will look at some future pandemics as well.
Oh, Veronica, I appreciate this time this morning, having this conversation, quite important. Veronica Ueckermann joining us there. Just about the lessons learned when it comes to the pandemic, Gareth, but also how we can make sure that we are better prepared, right, for any future pandemics, because we are a third world country. We are in a continent that is still experiencing less access to vaccines, communication, information, people still needing, of course, more technology in terms of to access this information. So hopefully, of course, we'll be better prepared should a future pandemic, of course, occur.
Yeah, not so much knee-jerk reaction as the Prof was talking about as well. Just a reminder on those numbers, by the way, the Professor was talking about 3,699 is the latest numbers in the COVID reports coming out, and that death rate you were talking about, 7 more people losing their lives. We'll bring you those numbers in more detail again a little bit later this morning. Well, there's